Today's discussion is going to be focusing on grooming of the individual. Hi, I'm Kathy Getrest, and I'm an instructor in community health. Personal grooming is particularly important to a resident's feeling of self-worth and well-being. The dignity of all human beings is directly related to grooming. Grooming includes hair care, shaving, and dressing. No matter what grooming activity is taken, encourage as much involvement by the resident as possible. The resident must be included in the process, even if participation is limited to just being able to make the choices. We'll start out by talking about hair and hair care. Hair should be combed and brushed every morning and as needed throughout the day. The purposes are many, some of which are it stimulates the circulation of the scalp, refreshes the resident. How many times have we heard the term someone having a bad hair day when seems like everything is going wrong? Generally, we feel better about ourselves when our hair looks attractive. Another purpose is that it removes lint and dust from the hair, and it helps keep the hair shiny and attractive. Some general guidelines when combing and brushing the hair. Place a towel over the pillow or around the shoulders before beginning. If the resident is wearing glasses, be sure to remove them to prevent any accidental breakage. Brush or comb the hair from the roots to the ends. To remove tangles, part the hair into sections, working one part at a time. Grasp the hair near the scalp to reduce pulling. Start combing at the end of the hair, working towards the scalp and the roots. Arrange hair in a style that a patient prefers. If the hair is long, it may need to be braided to prevent repeated tangling and snarling. Never cut an individual's hair. This task is left to a professional beautician, a family or friend of the resident, but it is not one of your responsibilities. Never place clips or bows in a resident's hair that make them look childish. And limit the use of rubber bands or clips for bedridden patients, as it can be uncomfortable when they're laying on their sides. Shampooing the hair is part of routine care. It's done weekly or as needed. For the elderly, it's more often done weekly, as elderly hair is dry and brittle and can become more so if frequent shampooing is done. Of course, with younger people, it is needing to be done more often. Shampooing may be done by a professional as well as cutting of the hair. Some facilities have beauticians that have a space right within their building. Shampooing may also be done as part of the shower or bath routine. The residents that are unable to sit in a shower may have their hair shampooed by placing a wheelchair or a stretcher next to the sink. Bedbound residents may have their hair shampooed while they are in bed. Regardless of the method used, the procedure should be done in such a way that the hair is thoroughly cleaned, the resident is not chilled. That means the hair should be towel dried or blown dry as quickly as possible after the shampoo is completed. Soap is rinsed completely from the hair, and the eyes and ears are not irritated by shampoo. It's always a good idea to check the label on the shampoo to make sure that you're using a mild soap. Now I'd like you to watch a demonstration of shampooing a resident at the sink, followed by one where the shampoo is being done in a bed.
Gather supplies. Cover the resident's eyes if necessary. Place towel around resident. Apply gloves and wet hair. Older residents do better bending head forward into the sink than backward. Apply shampoo and rub into hair with fingers to stimulate scalp. Rinse with clear, warm water. Gather supplies, place head into shampoo tray. Have one person lift head into tray and the other person wet hair using a pitcher or gallon milk jug. Cover the resident's eyes if necessary. Rub shampoo into hair and stimulate scalp with fingers. Rinse with clear, warm water. Notice how water runs out of the tray into bucket. Remove tray and dry hair.
Shaving is another part of grooming. It is usually done each morning as an activity for most men. This should not be neglected. The caregiver is responsible for assisting the resident if they're unable to shave themselves. However, the resident, when possible, should determine the shape, the length of a beard, mustache, or sideburns. Some female residents may want to shave their legs, underarms, or any excess facial hair. Excess facial hair is not uncommon, particularly in older women, and there might be an increase in the growth or coarseness of the hair on the chin, upper lip, In those instances, tweezers may also be used to remove some of that facial hair. There are two different methods for shaving. The first is a dry method in which an electric razor is used. Less likely to cut the resident when using an electric razor. However, it may not be used when oxygen is in use with the person because of an electrical hazard. Sometimes, however, the oxygen may be removed for the period of time the resident is shaved. So please check with the nurse, however, before doing that. The skin usually is dry when the person uses an electric razor, and the razor screen always needs to be cleaned after each use. Most electric razors have a brush that comes with them, but if somehow or another it has gotten misplaced, it's perfectly all right to use a toothbrush to clean the razor screen if needed. If the razor is being shared between individuals, it must be disinfected. The razor heads themselves must be disinfected between each resident. The other type of method is a wet method. With the wet method, a safety razor is used, more likely to cut the individual. If that would occur, then sometimes you'll see use of a particular kind of pencil called a styptic pencil, or there's a brand called Nicket that might be used to stop the bleeding. Because of the possibility of nicking by use of a safety razor, you would always want to be wearing gloves. Safety razor can be a disposable kind, or it might be a reusable razor. The beard is always softened before use of a safety razor. It may be softened by use of a warm washcloth on the beard ahead of time, or it might be a lather or pre-shave lotion that's used. Guidelines for safety in shaving a resident. Use the resident's own shaving equipment whenever possible. If the resident is receiving a blood thinner called an anticoagulant medication, an electric razor may be required. OSHA, the Occupational Safety and Health Administration, requires that disposable razors may only be used once, that gloves are to be worn, and they are then to be the disposable razor is to be disposed in a sharps container after its one-time use. Dressing and undressing a resident is another part of responsibility of grooming. Patients in a hospital generally will be wearing a hospital gown or pajamas as they're in bed a good deal of the time. In a long-term care facility, however, residents are dressed in street clothes because they're out of bed most of the day. Caregivers are responsible for helping residents dress, as well as for selecting clothing that is neat, clean, in good repair, and appropriate for the environment. The types of clothing is important because we want to select items that are easier for the resident to manage. Some examples might be a jogging suit. A jogging suit is warm and loose-fitting, which means that there aren't buttons or snaps or zippers that the resident has to deal with. Loose-fitting dresses can also help. Ones that have snaps or buttons only in the front. Sometimes residents will have special clothing. These are residents frequently who are wheelchair-bound, and they may have clothes that have secured in the back and are only open in the back for ease of placing on. Offer the resident an opportunity to choose their clothing and encourage as much participation as possible. This allows for a measure of control, which is important for most all of us to feel. Select 2 or 3 appropriate items and then ask the resident, which one of these would you like to wear? Selecting only a few is better than opening up the resident's closet and having them select something from a large variety of items. Sometimes that can be too overwhelming. Remember, too, that the elderly tend to require warmer clothing due to decreased circulation, so keep that in mind when making the selection. There are some special considerations that need to be made with certain residents. Some confused individuals may disrobe, meaning taking their clothes off at inappropriate times. Sometimes putting a jumpsuit on them can help deter this from happening. Also, there may be confused individuals that expose themselves. If that were to occur, placing pants or pajama bottoms on an individual can help protect their privacy and dignity. There may be times when you will be dressing residents who either have a type of feeding tube in them or intravenous catheter or some other kind of catheters. In those instances, they may use a hospital gown that has snaps at the shoulder in order to dress and undress them more easily. Sometimes residents have what is called an affected side. An affected side means that, for an example, there might be a paralyzed right arm or leg. There might be an intravenous in that hand. It might be broken leg or arm. It might be that the person has a good deal of arthritis, making for a very painful limb. That would be called the affected side. Always important to remember that you would always dress the affected side first and undress the affected side last. Some guidelines for dressing and undressing a resident. Most importantly, provide for privacy. Expose only those body parts that are being dressed at the moment. Organize the clothing for dressing and place them in easy reach for the individual in the order in which they're going to be put on, with the undergarments on the top. Have the resident sit on the side of the bed, or they might be in a chair for ease of dressing. If the individual is unable to dress themselves, then it's really safer for you to dress the person while they're in bed. Allow the individual to move at their own pace. Resident who has had a stroke or other brain injury may be relearning how to dress and undress themselves. Patience and understanding will encourage them to continue with self-care. Support any weak or paralyzed limb while changing the clothing. Be prepared to assist with shoes and stockings, even for those individuals that are independent in dressing and undressing the rest of their items. Bending over to adjust shoes can result in dizziness and loss of balance, and always use non-skid shoes to prevent falls. Now I'd like you to watch a demonstration of dressing a dependent resident with an affected right arm. Select appropriate clothes and arrange in the order of application. Encourage the resident to participate in selection if able. Adjust the privacy screen and cover with a bath blanket. Fan fold the top linens to the foot of the bed. Elevate the head of the bed and assist to a comfortable sitting position. Remove the night clothing, keeping the resident covered with a bath blanket. Note removing the clothing from the right side last. Place the night clothing in a laundry hamper if soiled, or fold for reuse. For placing on an undershirt, Place the front side down on the resident's lap with the top of the garment away from the resident. Put the hands into the bottom of the shirt and one at a time into the sleeve holes. Pull the sleeves up as far as possible on the arms. The shirt should now be higher up on the chest. Gather up the back of the shirt with their hands and slip over his head. Smooth the garment down and position comfortably. For putting on a dress shirt, insert your hand through the sleeve of the shirt and grasp the resident's right affected arm, drawing the sleeve over both of your hands. Gather the sleeve on the opposite side by slipping your hand in from the outside. Grasp the resident's left wrist and pull the sleeve of the garment over both of your hands. Assist to lean forward and adjust as needed. Button the shirt. For putting on underwear and slacks, facing the foot of the bed, gather the underwear from the waist to the leg hole. Slip over 1 foot at a time. Pull up on the legs as high as possible. Assist to raise resident's buttocks and draw the garment over the buttocks to the waist. If the resident cannot lift, assist to roll side to side after lowering the head of the bed. Adjust until smooth and comfortable. Repeat this process for the slacks. Facing the foot of the bed, gathering the slack from the waist to the leg hole, slipping over 1 foot at a time and pulling up onto the legs as high as possible. Rolling the individual from side to side and adjusting until smooth. For socks and shoes, roll the sock with the heel in the back and place over the toes. Draw the sock up over the foot and adjust until smooth. Repeat the process for the other foot. Slip on non-skid shoes. Open the laces completely so the foot can easily slip into the shoe. Tie the laces securely. Be sure that the ends of the laces are not long and drag on the floor. Now lower the bed to a safe and appropriate level for the resident to be able to get up from. You would reverse this process for undressing the resident.